Dr. Tracey, welcome to Age Better.
Thank you for having me on, Barbara. It's a pleasure to be here.
I am so excited. We had a nice chat on the phone last week, and at that time, I did reveal to you that I have a little bit of an obsession with the vagus nerve. And I decided about 2 years ago when I started this obsession that I had to have an episode focusing on the vagus nerve. And then I started asking people who are really in the know, including many esteemed medical experts, who should that person be? Who should that expert be on the show with me to talk about the vagus nerve? Well, Dr. Tracey, as I told you, and as you already know, all roads lead to one person and one person only. And that person is you. It was you. No one ever said any other name. And so here you are. How happy am I right now?
Well, I'm really happy to be here. It's one of my favorite topics, as you know, but we really need to put it out there right now. There are many people who know a lot about the vagus nerve and who've worked on it for many years. My colleagues here at the Feinstein Institute in New York, but others, friends and colleagues around the world in dozens, if not hundreds of laboratories. So it's a big, complicated topic, and I'm happy to talk about it all day long. But a lot of other people know a lot about it as well.
But I want to congratulate you. I mean, you had some really big news. You and your team at SetPoint, a company that you helped to found a while ago, actually, and you had an announcement that made the front page of the New York Times. That is hard to do, as we know. Usually anything medical is put back in the science section or, but this was on the front page because it really was big news. How does it feel? We'll get to what that is, but how does it feel that after decades of hard work and research with a team that you made this breakthrough? And it's an incredible and life-changing breakthrough. How do you feel?
I feel very fortunate to have met some patients now who have been treated with an idea that was born in my laboratory here in New York, but developed by a company that my colleague Shaw Warren and I co-founded in 2007, SetPoint Medical, a California company. And when you really understand the whole story of how many dozens and dozens at first, and then hundreds of people touched the science of this idea, going back to the late 1990s, actually,
Mm-hmm.
and then the investors who took tremendous early risk early on, investing in the idea, not only in my laboratory, but then later in the company, to the early employees in the company who took tremendous risk of their own careers and joined the company at an early stage before any of this was proved to be true. And then people in the company collaborating with investigators around the world to launch the clinical trials, and all the early patients who
And
took
the patients,
they
oh
took
my gosh.
they took their own risks signing up for a clinical trial, not knowing if they would gain any benefit, and perhaps hoping they would, but also perhaps hoping it would help other people. Then to the FDA and the regulators who had to take a hard look at this. It's totally new, the idea of using a device to treat rheumatoid arthritis instead of using drugs. This required a whole new way of thinking about things. Barbara, when you look at all those people and you look at all those years, you have to feel happy. Of course, I do feel happy, but you have to also feel very fortunate. And the icing on the cake is when you meet a patient who says that she's better.
Yeah.
And doesn't have to take medications anymore because her rheumatoid arthritis symptoms have gotten significantly better from this idea.
From this, an incredible breakthrough. And we will get into more detail about it, excuse me, in a few minutes. But first, before we do, I really feel it's important that for those in my audience who really don't understand exactly what the vagus nerve is, please just explain, what is it? What is it? Where is it in our body? And why are we focusing on it so much now? Why is it so important that we know about it?
The vagus nerve is a paired structure. So we say vagus nerve, but you actually have two of them, like two thumbs and two kidneys. And it arises in the bottom of your brain. It's technically, anatomically, it's one of the 12 cranial nerves, one of the 12 pairs of cranial nerves. It's the number 10. And so it starts down at about the base of your brain, at about the level of your ears, and it travels across your neck on both sides and across your chest on both sides, down into your abdomen. And all along the way, it's sending off branches. It almost looks like the roots of a tree. If you were to take all the dirt away and just see the tree roots, it spreads itself out to touch all the organs that you never think about all day long. And the reason that there's so much interest in it now, and there are billions and billions of web impressions and social media impressions,
And
is
a
be-
lot of social media influencers who are telling us how to, kind of stimulate our vagus, but we'll get to that later. Yeah.
absolutely, absolutely. The reason that people are trying to understand how to stimulate their vagus nerve or inhibit it in some cases is because the signals that it carries are coordinating how your organs in your body that you never think about all day long. It's coordinating how they work and how they work together in harmony. So you're sitting on the doctor's table, remember that time, and the doctor thumps your knee with a reflex hammer and your leg pops up and you said, "Who did that?" Well, that's a reflex. Those signals traveling in the nerves from your knee to your spinal cord and back to your thigh, those signals all happen very, very quickly and without your conscious control. Well, that same kind of thing is happening in your vagus nerve, but it's a little more complicated than that because I said you have two vagus nerves. Actually, inside each of the vagus nerves in your neck, you have 100,000 fibers. So really the way to think about it is you have 200,000 vagus nerves. And that's a rich source of data traveling mostly from the body to the brain. 80% of the signals travel from the body to the brain. But then from the brain back down to the body. And it's these signals traveling up and down from your kidneys and your pancreas and your liver and all the organs that you don't think about all day long. Those signals are informing the brain about the status of your organs and then reacting to the input with outputs that stabilize the function of your organs. And so that's the interest in the vagus nerve. It occupies a central role in maintaining sort of harmony and balance, which is what we call health.
Yes. Yes. It's just incredible. I mean, just what you described. I have a zillion questions to ask you. I could keep you here all day long, but I knew, of course, I had to kind of call the most important ones, at least the most important ones for me, and I believe for my audience. But a lot of the information I was looking for about the vagus nerve is included in your incredible book that just came out in May, just a few months ago, The Great Nerve, holding it up for everyone to see. Highly recommended, everybody, if you really want to understand. But not only do you give us the understanding of what's going on inside our bodies, like you just gave us the summary, but great detail about that, but also the history, how we even got to where we are right now, and also your incredible backstory. And you have a few backstories, really. Not only when you decided to enter the medical field when you were 5 years old, but also when you decided to kind of start going in this direction. It was moving, but will tell you a lot about the vagus nerve and also what motivates people to take the paths that they take. So highly recommended. But again, The Great Nerve, great book. We will talk about this a little bit more in a few minutes. But first, just wanted to get back to, so like right now as we're sitting here, what's happening? It's like 200,000 fibers going up and down, sending signals. I'm moving my hands. My brain is saying, my stomach might be growling. I don't know what's going on inside our bodies right now.
It's really an important question because it hits to a point that I think is commonly overlooked by the casual reader on social media or on the internet. So people like to say, well, I want to stimulate my vagus nerve. And when someone says that to me, I say, oh, really? You have 200,000 of them. Which one do you want to stimulate? And the reason that's an important insight is because we learned for instance, from laboratory studies. I'm thinking in particular of work done by my colleague and friend at Harvard, Steve Lieberless, whose laboratory asked a very simple question. If a mouse, which is of course a lot smaller than a human, has 5,000 vagus nerve fibers rather than 200,000, how many does the mouse how many are required to breathe, for the mouse to breathe? Now think about it for a minute. We can all walk and chew gum. Some people can play the piano and talk to their children or their dog. Other people can do multitasks and lots of different things. And the reason that we can do walking and chewing gum at the same time is that the nervous system is highly specialized. So individual nerve fibers have individual anatomic origins and insertions, beginnings and endings, and they have specific functions. And so you can operate different circuits, different nerves at the same time because they do different functions and they come and go from different places. Well, the same is true of the vagus nerve fibers. And so when Steve asked the question about breathing in mice, he discovered it was on the order of like 110 or 120 fibers were necessary and sufficient for the mouse to breathe. I mean, that's remarkable. That's a very small number of fibers. And so if you move that same kind of logic into a discovery that my colleagues and I made about how the vagus nerve signals can turn off or inhibit inflammation, we estimate of the 200,000 fibers that about 1,000 of them are specialized in turning off inflammation. Maybe another few hundred or 1,000 are specialized to slow your heartbeat. Others may be specialized, some small, relatively small number to control your insulin release from your pancreas. So when you start to put these pieces of the puzzle together, you come up with a really interesting mosaic where of all the information traveling in the vagus nerve, different fibers have the ability to significantly affect the outcome of different organ functions. And that's all happening essentially at the same time as we're sitting here talking.
It's just incredible. And you also mentioned a word that is my other obsession, and that's inflammation. And you were on the Tim Ferriss show just last week, actually. I listened to it. Really fascinating. Well done. But I recall that both of you were kind of snickering at the word inflammaging. And I have to say, I am guilty, very guilty of having used that word a lot when I write about it or talk about it. And maybe I'll stop using it now because I don't think you really like that word so much. But you came up with something called the inflammatory reflex. So, kind of explaining how the brain through the vagus nerve can actually turn off inflammation. And inflammation, as we know, and as you discuss with Tim Ferriss, is like a root cause of so many chronic diseases and ailments that we have. Arthritis, Alzheimer's, I could go on and on and on. So talk to us about that, please.
I think there's a really important point you're making about semantics. And so let's start with what a definition of inflammation is, and then see how it applies to inflammaging and other uses of the word inflammation as might occur in Alzheimer's disease or diabetes. Because it turns out it's not so obvious to me anymore. We really probably do need more precision in the words we use to talk about this. Let me explain what I mean. Inflammation was defined thousands of years ago by Galen and others before and after him to mean the heat, the redness, the swelling, and the pain that occurs at the site of an injury or an infection. Now, that's what inflammation has been for 2,000 years. In the more modern era, the last 20, 30 years, we've come to understand that those conditions, redness, heat, pain, and swelling, those conditions come about because of molecules made by white blood cells, molecules called cytokines, and other molecules like eicosanoids. And these molecules contribute to your body's ability to make that redness, the heat, the pain, and the swelling. Okay, so now we've taken inflammation from something you can see in the infected pimple on your arm to molecules and cells that you can't see. So what does it have to do with inflammaging or the inflammation you see in the context of, say, Alzheimer's disease? Well, if you look in the brain of an Alzheimer's patient, you don't see redness, you don't feel heat, there's no pain associated with it, and there's no swelling really. If you look at the pancreas of a patient with type 2 diabetes, which is caused by insulin resistance and is typically seen in the obese population, you might see some, if you have a sophisticated laboratory and are able to do this, you might be able to measure those molecules I talked about, the cytokines and the eicosanoids, but you don't see a lot of white blood cells. You don't see the other signs of inflammation, the heat, the pain, the redness, and the swelling. So we really are running out of appropriate words to describe what we really already know. When you apply this to aging, what we see in aged tissues and aged people, you see the accumulation of some of these inflammatory molecules. And the word inflammaging has been used by a lot of brilliant people and published in a lot of important peer-reviewed manuscripts. There's nothing wrong with the word. The question is, how do we incorporate that into what we know about how to treat inflammation today with biologic agents, with the drugs you see advertised in every nightly newscast and in every Sunday football game. That's where the disconnect comes, is connecting the molecular mechanisms to what we're calling inflammation. I think I've challenged my colleagues in this book, in The Great Nerve and elsewhere. We maybe have to start to think hard about the words we use to describe what we understand. It might be time for kind of a little bit of a shakeup in how we describe inflammation.
I agree with you. But what's the connection between the vagus nerve, getting back to that, and the brain, and how does it really impact inflammation? What's the connection?
The connection, which came as an enormous surprise
Yeah.
some 25 years ago in my lab, give or take, the connection is that the brain sends signals down the vagus nerve to your spleen and other organs and can turn off those molecules, the cytokines and the eicosanoids and the white blood cells that actually cause the inflammation. And that discovery, which came after an unexpected finding, we were actually studying the brains of animals with a stroke. And we put an anti-inflammatory molecule into the brains of these mice and rats in the hopes that reducing the inflammation in the brain would reduce the amount of damage from the stroke. And then that did happen. That's what we expected. But what we didn't expect is that when we put this anti-inflammatory experimental drug in the brains of the animals in very small amounts way too low to actually go into the body and act as inflammation suppressing drugs. In these very same animals, when the drug was in the brain, the inflammation in the body of the animals was turned off.
Incredible.
It
Incredible.
took months to realize and prove that if we cut the vagus nerve in those animals, the effect was lost. And so we had proved back in like 1998 that signals traveling in the vagus nerve were like the brakes on your car. And if you turn on those signals, like turning on your brakes when you pump on the brakes, that you could slow the amount of inflammation in the body. And so I wrote on the back of a napkin in 1998, we should be able to develop computerized devices implanted on the vagus nerve in the neck of people with severe conditions like rheumatoid arthritis to turn down the amount of inflammation they're experiencing and potentially to give them relief from their condition. And you talked about the front page of the New York Times in the opening, and that's exactly what happened. The
Yeah, let's get
FDA.
right to that now. I want to
Yeah.
go into detail about that. I want people to know about it. And there will be a link to the New York Times article as well, of course. But so it's a SetPoint device. That's the company you founded. And so what does it actually do? And how does it stimulate the vagus nerve to reduce that inflammation so it could impact the severity of the symptoms of people with rheumatoid arthritis? And as we know, and as you describe in your book in great detail, and also in the article in the New York Times, that rheumatoid, as we know, rheumatoid arthritis can be debilitating, and there's no cure, and it just gets worse. I mean, you can't, these people who have been, who are your patients, who have been in the trials and so on, they actually are living their lives again. It's just unbelievable. So tell us about that.
To begin with, what rheumatoid arthritis is, as you said, it's not the sort of my knee is sore because I injured it playing volleyball in high school and now it's going to rain tomorrow, that kind of thing. This is a serious autoimmune condition. It's occurs in people whose immune system have, for unknown reasons, no one knows why, begun to
I hate to
direct.
interrupt
Yep.
you, but I just want to point out, in case you weren't going to, that this does affect, I believe, 3 times as many women as it does men. Am I correct?
Absolutely right. It
Yeah.
tends to affect women more than men, and it tends to affect people in the prime of their lives, in their 20s, 30s, and 40s, and it can be quite disabling. And what happens is the immune system sets up an attack against the joints. You've seen many people have seen the pictures or have relatives where their hands are badly deformed from rheumatoid arthritis, and this used to be more common decades ago, but it still can lead to significant bending and deformity of the joints. It can lead to severe pain, disabling pain. The pain in the joints can be so severe that some patients can't pick up a pencil or ride a bicycle anymore. Some patients can't even walk up a flight of stairs or button their own shirt or blouse. So yes, it's a serious condition. It doesn't only affect the joints, but it can also affect the other organs like the brain and the kidneys and even the heart. So it's a serious medical condition. The primary treatment for years has been to use drugs that are called biologics that are often injected, almost always injected, every 2 weeks or once a month. And they work at about 40% of the patients or so. But unfortunately, for the patients that don't gain benefit, there's few other options. The biologics and even some of the oral drugs, called the JAKs or the JAK inhibitors, those have very serious side effects. In fact,
Yeah.
many of them carry black box warnings, which is the most serious side effect the FDA can give. And so the point is if there's an option for some of these patients who are not getting better from their current therapy, then the patients are very interested. Now, to give you some insight into how interested the patients actually are, when SetPoint Medical was launching its clinical trial of this idea to implant a vagus nerve stimulator in the left neck about the size of a multivitamin or a fish oil pill that would activate what's called the inflammatory reflex. We can talk about that for 1 minute a day. They needed 242 patients in the final trial. We can talk about how the patients were randomized. But what was so amazing and telling for your listeners is that upwards of 25 to 30,000 patients, 25 to 30,000 patients logged into the website and filled out the application. It wasn't just a one-click thing and done. These people sat there and tried to get enrolled into the clinical trial. So you tell me about the pent-up demand in this population looking for new options. But I think the point really is clear that if you look across the universe of patients, there's 1.5 million eligible patients in the United States today, that there's a tremendous interest in pursuing a therapy, even if it requires a 1-inch incision as an outpatient procedure in your left neck. There's a tremendous interest in people wanting to try this because they're not happy with their current medical therapy.
Of course. I mean, and the New York Times rightly called it a true paradigm shift. I mean, this really is a shift in treating RA specifically. And it, why is it so different? Well, I guess you already explained that, why it's so different than what has been done, the treatments that have been available for decades. There are side effects. There's a black box in some cases attached, and they don't always work. And also, my understanding is that you have to be on these drugs forever. I mean, it's not like a, one and done. And so there's a cost involved, very, very expensive. So you have that going. And then now you have this new paradigm. You have this new treatment. And so how are people feeling about that? Are you constantly getting more and more people who want to get enrolled? With no more trials, I mean, the trials are over. But to get this treatment, like what's happening? What's the status?
There's a tremendous interest now in patients who want to seek this therapy from their rheumatologists because they have either not had successful treatment with their biologic, or they can't afford the biologics anymore, 50 to $100,000 a year,
Yep.
or they don't like the side effects, or they don't like injecting themselves because that's another way of having an invasive therapy, right? And so, yeah, there's a tremendous interest in this. To begin to handle some of this interest and to offer the services here at Northwell Health in New York, we opened a few months ago in preparation for this a Center for Bioelectronic Medicine that is available to treat patients. Now, the FDA approval today is for rheumatoid arthritis in people who are either refractory to, not responding to, or can't tolerate biologics. And that's very clearly laid out by the FDA's label. But for patients who are interested, we have a patient navigator, and you can email all one word, Center for Bioelectronic Medicine, Center for Bioelectronic Medicine at northwell.edu, and patient inquiries are answered through that from a navigator. I think that at the end of the day, we have to acknowledge that clinical trials will continue.
Okay.
Worldwide, I estimate maybe 300 people have been treated in various clinical trials using bioelectronic vagus nerve strategies to treat either rheumatoid arthritis or Crohn's disease. So these are still early days.
Yeah.
The results you pointed out, there have been some dramatic clinical effects. I've met several patients, including Kelly Owens, who I write about in the book, and whose cane is sitting here behind me in the corner of my office because she doesn't need it anymore. It's a beautiful
The
story.
cane. That's a great story. Again, in the book, in The Great Nerve, everyone, a wonderful story. And she's really in several places, including, Tim Ferriss and I agreed. We really both like that chapter toward the end, the coda. And when we hear a little bit more about Kelly, and just an incredible story. What she did to put herself in those trials in Europe at that time. It's a wonderful story. Can you just tell us a little bit about Kelly? Do you
Sure.
mind? Yeah, thank you.
Kelly was was alive and well. Kelly, as a young girl, a teenager, developed a swollen knee after a minor sports injury. And one thing led to the other, and she was given a diagnosis of Crohn's disease, which is an inflammatory bowel disease, which is an autoimmune condition. And in Kelly's case, she not only had gastrointestinal issues and symptoms and signs, but she also had inflammation that settled in her joints. So she looked almost like she had rheumatoid arthritis, although her actual diagnosis was Crohn's disease.
Mm-hmm.
So she was treated in New York and in the Mayo Clinic and in Hawaii and other places in between, New Jersey, but was finally being told by her physicians that they didn't have any other ideas for her other than spending the rest of her life taking steroids, which of course is something nobody wants to do. The side effects are terrible from that too.
Right.
Anyway, she heard me on Huffington Post Live, and she emailed me or called the office, I'm not sure which, and I recommended to her, or my office did, that she seek the clinical trials from SetPoint Medical. Well, she found a trial being opened in Europe, one of the first trials, and she talked her way into it, sold all her earthly belongings, moved to Amsterdam. In order to do this,
With her husband, I
with her
believe.
husband Sean,
Yes.
yep, with Sean. As they joke, they sold everything that wasn't chained to the floor. They did a GoFundMe kind of fundraising thing with
Mhm.
families and friends and neighbors.
Mhm.
And she moved there. She and Sean moved there for 6 months. And at about this time, after she had her vagus nerve surgery, implanted a device in her left neck. Her device I call Gen 1. It's like a cardiac pacemaker that sits under the collarbone, and then a lead that is tunneled under the skin up to the left neck where it meets the vagus nerve by the carotid artery. She had a surgery. It was very uneventful, very successful, and they were going for a follow-up appointment to see the doctors in the trial. And there was elevated train there on the way to get her to the hospital, and Kelly saw they were running late, and she ran up the stairs to hop on the train, and she turned around like, where the hell's Sean? And he was standing at the bottom of the stairs with tears in his eyes because he couldn't remember the last time he'd seen Kelly be able to run up a flight of stairs.
I love that story so much. I read it and reread it. And I would love to have Kelly on my show too.
Oh, you should.
And in fact, I'm going to make that happen. I would love to hear from
great.
her, and I know my audience would love to hear from her too.
Kelly's great. So
yeah.
I got
Yeah,
to know her
that's a
very
great
well.
story, and, wow.
We
So you got to know her well.
I get to know her very well because we hired her. She worked at the Feinstein Institute for several years with me and my colleagues. And her role was to be a leader of patient advocacy. She collected all the emails and phone calls we were getting and built a database of patients who were really interested in helping by joining clinical trials. But that really takes us back to where we are now. You know, we talk about Kelly as such a success story, and she is. And I've met several other patients with similar stories now. So she's not a one-off, but we still don't know, Barbara, and this is really important. No one's advertising this as a cure-all. No one is saying this is going to promising this is going to help everybody. There's still a lot that we have to do and a lot that we will learn, because I fully expect that based on the current data are that 80% of the patients 1 year after the vagus nerve implant, these are patients that were selected because they have rheumatoid arthritis, but are not getting better with biologics or JAK inhibitors, that in that cohort of patients, about 80% of them derive some significant benefit. That means 20% either derive no benefit that was noticeable, and some cohort of the 80% had a highly had a much more significant advantageous response than the rest. So how that all sorts out is something we have to be eyes wide open and very careful, but it's very, very clear that this can be done safely. It does not cause immunosuppression.
Mhm.
It does not cost $100,000 a year for life,
Right.
recurring annually, and it can be safely done. So I think it's going to come down to early adopters and late adopters on the physician side. I think you will have some physicians very aggressive about recommending this for their patients, and some other physicians who will be cautious, conservative, and go much slower, and that's okay. That's
Yeah,
okay.
yeah,
But
yeah.
you're also going to have something happen in the patients, and you're going to have patients who are now better informed and smarter than any other time in the history of the human race, because they have access to the data and they can make decisions. They can participate in some of the decision making, and I think you're going to have patients demanding this.
Absolutely. And just so my audience knows, right now is Northwell at your center the only place where you can get this treatment currently?
That's a question for SetPoint
Or
Medical.
at
They have,
some point? Yeah,
yep. SetPoint Medical has an outstanding website. I would encourage your patients to look
I'll put it
there.
into the show notes so they can take a look. Yep.
We
Mhm.
we we did implant the first 2 patients under FDA approval about a week ago at Northwell, the first anywhere in the United States, and those patients are now out there, about ready to. I would imagine it was about a week or 2 ago, so they'll be in the process of having the device activated, and hopefully they'll have a clinical response. There are a lot of logistical issues to launching a brand new medical product. There are logistical issues with establishing what's called prior authorization mechanisms, dealing with the insurance mechanism. All those things are happening. There's an army of people working on that at Northwell and at SetPoint. My understanding is that SetPoint will have a sort of a slow launch in the coming weeks and months at several sites across the United States, where there will be the necessary expertise and experience. You don't want to launch something completely new just out into the universe and see what happens. You want to, for the sake of everybody involved, you want to have the best people who are trained to do this, doing it on the right patients in a few select centers, and I believe that's the phase we're in now. However, in the coming months and years, I think you're going to see a lot more clinical trials. I think you're going to see studies in multiple sclerosis. I think you're going to see more studies in inflammatory bowel disease. And who knows, the list of potential autoimmune conditions that should be studied. We don't we don't know until we have the randomized clinical trial data, but should be studied. It's a long list.
It's a very long list, and just curious too, do we know yet if the stimulator, if it needs to be repeated? Do we know that?
We know that it won't
Like, will it wear
need
out?
the label from the FDA on the device. The device is the SetPoint device is called an immunoregulator, and we can
Mhm.
talk about how that works. but the label for that device from the FDA gives it a 10-year lifespan. That doesn't mean it'll stop working after 10 years. It may, in some cases, it may in fact last for the lifetime of the patient. See, the battery is rechargeable. So the chip itself has it has a computer motherboard. It has an antenna that talks to the doctor's tablet or iPad. And it has a lead which touches the vagus nerve, and as I said before, and a battery. And as I said before, it's wrapped. It's about the size of a multivitamin, but it's wrapped in a pea pod that holds it in place on the vagus nerve. And once a week or so, the patient, and there's nice pictures of all this on the SetPoint website, but once a week or so, the patient puts on a charging collar and wears it for an hour or so, and that charges the battery. So no, it should never need replacing.
Yeah, just similar to a pacemaker.
Similar to a pacemaker, only in this case, of course, it's a lot smaller.
Yeah.
And the other big difference is that the immunoregulator activates the inflammatory reflex to stop inflammation for 1 minute a day. But by the nature of the mechanisms, the neuroscience and molecular mechanism that we worked out in my lab and in labs around the world and in SetPoint's labs, by the nature of understanding those mechanisms, we realize that there's an amplification of the 1 minute signal, and that amplification, which stops inflammation, persists for between 12 and 24 hours. So a 1 minute stimulation is all you need every day.
Incredible. Just such a small amount of time. I'm also curious about those people who, I think you said 20% of those who have participated didn't really have the positive outcome as you had hoped. Is there any indication in your mind prior to their having this performed that, oh, these people may not have the same as good an outcome as others? Is there anything, or is it a complete surprise?
As of today, we can't look at a patient before they've gone into the trial or in for the therapy and say you are or you're not going to respond.
Mm-hmm.
What we did see in the first clinical trial, which was presented at the American College of Rheumatology last year, and now almost all the data are available on the SetPoint Medical website. But what that data shows is that patients who had tried 3 different biologics versus those that had tried only 2 versus those that had tried only 1, that the patients who'd been on 3 now, usually that means they've had serious disease for a much longer period of time.
Right.
And those patients tended to have less significant responses in some cases than those patients who had only been on 1 biologic. I mean, Barbara, the way to think about it is name a disease or condition, any disease or condition, where treating later is better than treating earlier.
Yeah, I can't think of one.
And so, right. And so I think what we're going to learn is going forward in time, if it works in a significant percentage of patients when you treat them early versus late, then how many people should be treated earlier and earlier? Right now, the FDA approval is for treating patients who have, as I said before, are either refractory, not responding to, or cannot tolerate the biologics and the JAKs. But maybe someday, could I imagine a time when the device is used instead of those drugs? Yes, I can. I can imagine that
Yes, you can. I know somewhere, I think when you and I were on the phone, I read in the inside, not on the cover, but the inside of the book jacket, and that really struck me how, and I quote, how the vagus nerve can regulate your body's vital systems and heal a wide variety of medical conditions without drugs. And so basically, I think your goal, I'm going to simplify it, tell me if I'm wrong, is to really have this and all its different uses eventually replace a lot of the drugs that people are on for these chronic conditions, right?
To the extent that inflammation is the target, in other words, to the extent that people are using expensive
with side effects in
medication
many
with
cases,
serious side
maybe
effects,
don't let make them feel ill.
I mean,
there are so many reasons why you would want to consider this.
And I think for where we are today is the first FDA approval for rheumatoid arthritis. Where we need to go is we need to continue to do randomized clinical trials.
Right.
And
Lupus. I wrote down a few that are kind of in that category of autoimmune. Lupus, Crohn's. You mentioned that multiple sclerosis, of course, Alzheimer's. We mentioned, and I guess the common thread across all of these is inflammation. Right?
that's the key to this. And
Yeah.
so to wave your hands and say inflammation is the root cause of everything, that's an exaggeration. However, when you look critically at what's killing people on the planet Earth today, well, 60 million people die according to the WHO. 60 million people die on planet Earth every year. 40 million of them, 2/3, die of cancer, heart disease and stroke,
Yep.
neurodegeneration like Alzheimer's and Parkinson's and other conditions like that, metabolic syndrome, diabetes, obesity. Now, what do all those things have in common? Inflammation. Inflammation either makes them worse or starts them up
Yeah.
or contributes to the bad outcomes associated with that. So now I like, as a scientist, as an inventor, I like to ask a question. If we could stop inflammation, would you lower the severity of ovarian cancer or endometrial cancer or uterine cancer? These things are linked
Yes, they
to
are.
insulin resistance and to inflammation. If you lowered the inflammatory burden, would you lower the death rate from some cancers, inflammatory breast cancer? Maybe.
That's the
It's a
big question that you
It's
must all be asking in your lab.
well, look, my lab's not big enough to answer all these questions, and that's why that's why I wrote the book. And as you know, you read it. There's a plea in the book to not talk about this as snake oil. Okay, the vagus nerve control of inflammation is not snake oil, and it's not going to help 100% of people. It's just that's not how biology works. However, it's a really important series of questions that we can now ask. A great example is depression anxiety, where the FDA approved vagus nerve stimulation for the treatment of depression in the 1990s. Why does everybody not know that? Well, because it only works in about half the patients. Why does it only work in half the patients? Well, we're not really sure what the mechanism is. And so there's a scientific question there. Can we connect the dots between reducing inflammation using vagus nerve stimulation and depression? And the answer is, well, sure you can, because when you have inflammatory mediators surging through your bloodstream, you become depressed.
Yeah.
You become fatigued, you become anorectic, you lose interest in food and in sex and in your hobbies
In
and
life.
and in life.
Yeah.
And so now the question is, did the 50% of people with serious depression who did get better with a vagus nerve stimulator, was that because they had an inflammatory condition that got better with the vagus? The answer is maybe, but nobody knows.
Yeah.
So we've got to stop and take a breath, all of us, and, the patients and the clinicians and the researchers, and say, what are the important questions we can ask now with new technology? And rather than dig our heels in the ground and say, well, it's always been done this way or that way, we have new technology and new questions. What are the clinical trials we have to do? It's really an exciting kind of idea.
Oh, it's an exciting time. And we will right now get to some other, new technology, some new treatments that are out there that are maybe not as invasive. Not that that's incredibly invasive at all, but and we'll get to those in a second. But I'm just wondering. I mean, it kind of begs the question. Like you mentioned knee arthritis. You mentioned arthritis that you might, little pain in your knee. I have that. It's probably age appropriate. And it's kind of sidelined me a little bit from running marathons at the moment. But I mean, it begs the question, if I came in and said, please implant that into my neck, isn't it possible that my arthritis could be alleviated?
So the arthritis in your knee from presumably recurring stress or running injuries is not rheumatoid arthritis. And so
No, it's not.
so the scientific answer is we don't know.
We don't know.
We don't
Okay.
know if a vagus nerve stimulation in humans with osteoarthritis would benefit them. But you could do the clinical trial someday, right? With the right
Yeah, count me in. Count me in. I'm putting my name in. I'll be one of like the 100,000 people who put their names in.
There are, if you go on clinicaltrials.gov, you will find osteoarthritis trials with various devices that people call vagus nerve stimulators. But before we dive into that, in reality, there's only two ways to stimulate your vagus nerve specifically and or selectively. One is to have a surgery and put a device on it, and this surgery has been done in more than 250,000 people who've been followed over decades. So we know how to do it. We know it can be safely done. We know it doesn't cause immunosuppression. It doesn't have a black box warning. So that's one way. The second way to do it is to use focused ultrasound, which is still an experimental modality. It's not available for widespread use. Those are the only two vagus nerve stimulators. Now, if you Google it, you'll find dozens and dozens of things being marketed and sold as vagus nerve stimulators that don't require surgery. And there we have to be really careful before we part with our money. We have to really look hard. Is the device FDA approved? What's it what is it? What did the FDA approve its use for? Is it and has it been subjected to well-controlled, large randomized clinical trials, and have those been replicated?
Yeah,
So
no,
those are
this
the
is
kind of questions.
so important. And then, so just jumping on that, so you envision less invasive approaches in the future, like external wearables, perhaps, and we also things like focused ultrasound. And you were a part of creating the Focus Ultrasound Foundation, too, which I'm going to put a link. Yeah, a lot of links are going to be in the show notes, everyone. So lots of reading for you. And also TENS, TENS, and VNS. You talk about all of these in your book, The Great Nerve. But just talk to us a little bit about them. I mean, those are available at the moment.
I think it's really important to point out that for your listeners with severe rheumatoid arthritis,
Mm-hmm.
if it was as easy as buying a TENS unit or something over the counter or doing a few extra push-ups or sit-ups and their rheumatoid arthritis would be better, they'd obviously all be doing it.
Right.
So I think there's going to always be a need for implanted devices, like the SetPoint immunoregulator, which through a one and done incision to have the kind of clinical effects that are possible in some patients, that's not gonna go away. Now you have people like you perhaps, like me perhaps, we're pretty healthy, we're fortunate, but we wanna see if there's ways to reduce some aches and pains or reduce our potential risk of inflammation. What is the data on that? Well, the data is really interesting. So there's a large amount of clinical trial data. Most of it is small trials. Most of it's not randomized or well controlled, but there's a lot of suggestive anecdotes that using a TENS unit to treat the ear, particularly the left ear for some reason, that's where most of the studies have been done, can in some patients significantly reduce inflammation. Now, my colleagues and I at the Feinstein Institute here in New York, we saw this in lupus arthritis patients whose arthritis was significantly, their pain anyways, and their arthritis scores were significantly reduced with this approach. So you have clinical results, and you have the use of a TENS unit in the ear, and you have a branch of the vagus nerve that goes to the cartilage of your ear. So is that vagus nerve stimulation? No, not really, because you have other nerves that go to your ear. So you don't really know when you put that TENS unit in your ear if you're stimulating the vagus nerve or a branch of the facial nerve or the trigeminal nerve or the superior occipital or some other nerve. So it's a semantic issue, again, to a point. And if it was just a semantic issue for scientists or physician scientists talking among themselves about how something works, that'd be fine. But people are spending a lot of money on this.
Yeah.
And now, I think caution is warranted. If people have money they want to spend and they like to self-experiment, I think I'm a fan of that. I think it's kind of fun, actually, to self-experiment with various healthy techniques, as long as your physician says it's okay and it's safe. But some people don't like to self-experiment. Some people want to spend their money on things that'll help them feel better. And there, I think you have to be really careful. You have to look at what the FDA label is and what the clinical trial results are for the condition you're trying to treat, including your sore knee.
Right. I'll be careful when I'm looking around when I'm Googling or my new favorite thing, perplexity. Let's talk about social media because we have to. So there's been a lot of buzz, as you said earlier on, about the vagus nerve and stimulating the vagus nerve in all different ways, even selling some products, as you just pointed out recently. And we talked about this last week. I listened to the Huberman Lab, as did you, his episode about the vagus nerve. And he was talking about, putting your finger in the ear and or rubbing your ear and so on and so on. A lot of different things. There are a lot of talk about stimulating the vagus nerve, and every influencer out there seems to know how to do it better. So let's just talk about, let's cut to the chase, Dr. Tracey. What really does work? Sounds like nothing. And what should we just no, don't do it.
I think Andrew Huberman did a really good job and in his podcast talking about the fact that the vagus nerve has lots of fibers, and that one way that you can sort of measurably, quote unquote, stimulate your vagus nerve is through changing your breathing.
Mm-hmm.
So if you think about it for a minute and you want to breathe in on 3 and out on 7, that's 10 seconds. That's a cycle of 6 breaths a minute. Okay, so far so good. Now, you think about changing your breathing. So therefore, you get your stopwatch or you start counting to 3 in your head and you inhale 2 big inhales through your nose,
Yeah.
like sniffing, and that fills your lungs. What happens in that 3 seconds to your vagus nerve? Well, we sort of talked about Steve Lieberless in the beginning of the podcast, and there are fibers in your lungs that are traveling with your vagus nerve that are sensory, meaning they're carrying information from the lungs to the brain,
Mm-hmm.
and they're going to inform the brain how much pressure is in the lungs and how much carbon dioxide perhaps is in the lungs. And so there you go. You've stimulated your vagus nerve, right? Technically, that's
Okay.
but what does that mean? Well,
Right.
not really sure. Now, those signals go into your brain and they activate reflex circuits that can go to places like the locus ceruleus that actually controls your sympathetic outflow, your fight or flight response. It also sends projections up into your brain that affect how your emotional state and even potentially your ability to learn and make new memories. It gets really complicated really fast if
Mm-hmm.
those few fibers from your lungs send a signal up into your brain. But put that aside for a second. One of the relays of those incoming signals is outgoing signals from the vagus nerve nuclei called the dorsal motor nucleus of the vagus and or the nucleus ambiguus. Some of those fibers now go from the brain back to your heart. And now what's going on with those? Well, as you exhale now for 7 through pursed lips on a slow count of 7, so you get back to the 10-second cycle,
Yeah.
you'll feel, if you check your pulse, you'll feel it slow down.
Yes.
That means that you have stimulated the fibers from your brainstem to your heart that slow your heart rate. So that's only a little subset of all the vagus nerve fibers that you actually did stimulate, because there are vagus nerve fibers that are transmitting information about lots of other organs in your chest and your larynx and your airways back and forth from your brain when you take that in on 3, out on 7. So the simple answer is, if your heart rate slows, you have sort of an actionable or objective measure that you've stimulated the vagus nerve fibers to your heart. Does that mean that in on 3, out on 7 also stimulates the fibers traveling from your brainstem, dorsal motor nucleus, down to your spleen to stop inflammation? Nobody knows.
Nobody knows. Okay.
Nobody knows.
Okay.
Now, if you're
Interesting.
if you're incapable of walking and chewing gum, and that every time you chew gum you start to walk because all of your nerve fibers are firing at the same time, then you might say, okay, the heart rate slowed, I must have less inflammation now. But I don't believe that the nervous system developed that way, evolved that way, or functioned that way, because I don't know anybody who can't walk and chew gum at the same time. And I think you can separate the signals to the heart from the signals to the spleen and the signals to the lung. And the challenge now in the modern era is to answer this question. How do we actually, what methods can we put in place? What kind of tools can we invent to record the activity of all 200,000 vagus nerve fibers in humans in real time? We can't do it today, but someday I bet we can.
No, that's really incredible. So really, in summary, then, you're helping to slow down your heart rate if you do that breathing. And I think I told you on the phone last week too, one of the reasons I became so obsessed with the vagus nerve is about over 2 years ago. I had on the show Patrick McEwen, who's written some books about breath work and breathing properly. And he convinced me that, it all goes back down to the vagus nerve, and you can, in fact, control your vagus nerve. I mean, he was very sure about that you can control your vagus nerve with proper breathing. Whether that's true or not. I have found that proper breathing, according to Patrick McEwen, does help to lower my heart rate. I mean, sometimes for fun, I'll just look at my Apple Watch and kind of put the pulse thing on and just watch it come down by doing that breathing. Now, again, am I also impacting my spleen? I think we don't know, right? Is the point. We don't know
know.
that.
And I mean, you could quibble with semantics, but in science and medicine, semantics are sometimes as important as anything. And are you really controlling your vagus nerve, or are you controlling your breathing?
Right,
You're controlling your breathing,
right,
right?
right.
I mean, there's a guy named Wim Hof who's done a lot of work with cold exposure and combining a series of rapid, deep breaths, followed by a prolonged breath holding, and then repeat the cycle 30, 40 breaths, big, big inhales, big exhales. And what he's doing is he's accumulating carbon dioxide in his bloodstream by a series of repeated hyperventilations. So he subjected himself to study in a study led by Peter Pickers, another colleague in Amsterdam.
Mm-hmm.
And what they found is that the breath work was a massive, and the breath work in this case being this rapid breathing followed by prolonged breath holding, that stimulated a massive fight or flight response. Now that's the opposite, of course, of a vagus nerve response. Vagus nerve we like is often called rest and digest or parasympathetic, and
Mm-hmm.
the fight or flight is the sympathetic response. Well, this massive fight or flight response acutely turned out to have a very profound anti-inflammatory effect. And so here is another example where many people are quick to say sort of casually, well, if fight or flight is on, rest and digest must be off because they're opposite. They're not opposite. This is a great example where fight or flight has an anti-inflammatory action as an acute, powerful event. Vagus nerve stimulation as an acute, powerful event also has an anti-inflammatory action.
Mm-hmm.
And in fact, during fight or flight, it doesn't mean the vagus nerve has been turned off. It's just while it's working, you can't see it because its job is to slow your heart. And what you see during fight or flight is you see an increase in heart rate.
Right.
So there's a lot to unpack there.
Oh my God, it's so complicated. It's so complicated. But just give us the bottom line on that. Hop's research and what he did, the experiment. What was your takeaway of that? So, will this cold plunge? It clearly it affected his breathing and his heart. That, in your opinion, did it stimulate the vagus nerve or no?
The acute exposure to cold, if you put your shower on full cold or jump in an ice bath, the acute exposure to cold causes fight or flight. That's the acute response. You feel all the air go out of your body, it hurts, you think, why am I doing this? That's fight or flight. And that's been studied and documented very, very, very clearly that the acute severe cold exposure causes fight or flight. That's why you have to check with your doctor before you do it. And you should never combine the breathing exercises and the breath holding with anything in a swimming pool or an ice bath. You should have colleagues there. You shouldn't do it alone.
Yeah.
So
Yep.
because that has led to some deaths, and the combining of the two has to be done under supervision if you do it. But I'd recommend you don't do it. Anyways, the acute cold event causes fight or flight, which I just said is anti-inflammatory. So check that box. That's good if that's what your goal is.
And
I find that if I stay in the cold until I'm cold adapted, that it's almost like I'm watching it happen to somebody else. It's I'm aware of it, and I'm aware that it's not comfortable, but somehow it doesn't bother me so much. Now, once you're in that state, I won't call it relaxing because that
yeah, that
gives us
that doesn't
different
sound relaxing.
no, gives a different connotation. But if you're in that state and you check your pulse and you find that your pulse has slowed, now you have, in fact, you could go back to the argument we had before. You can make a strong argument that that's a state of vagus nerve stimulation. But that usually takes a few minutes of being in the cold until that adaptive phase occurs.
Yeah, yeah, and it sounds like you do it because you said, "When I do." Am I right about that? Did I catch
Yes.
that right?
Yep. I don't
You
do it every day, but several times a week, I'll put the shower on full cold, and I'm hedging my bets, right?
Yeah.
It's Pascal's wager.
I
If
agree with you completely, you know, and I saw a lot of studies about that. And in fact, when my last book came out and I had the good fortune to be on Live with Kelly and Ryan when Ryan was still on the show, talking about it. And one of the things was I said, "Hey, Ryan, you can just dunk your head into this bowl of ice cold water and you'll get like 75% of the benefits of being under the shower." And he did it, which was kind of pretty funny on live TV that he did that. But anyway, and I thought that was, gee, I hope I just gave, really good information or or not.
you did, so
Not 100% of the benefits, but some benefit.
well, I think you gave good advice. I saw that episode, and congratulations for that. I think what you what you're doing when you put your face in cold water is you're doing a couple of things. First, you're holding your breath, which is an input into your brain that there's breath holding going on. And if you stay in long enough, carbon dioxide will rise in your blood. So there's more stimulation of information to your brain. But you're also stimulating the trigeminal nerve, which is the sensory nerves to the face. And those nerves activate the diving reflex, which is so when a seal or a whale or deep diving animals go underwater, that when their face, their nose hits the water, that activates the signals in their trigeminal nerve, which sets up an ancient evolutionarily conserved reflex, which slows heart rate because it stimulates the vagus nerve. Now, when the baby falls through the ice and is underwater for 20 minutes and then is finally rescued from the frozen pond or lake and is revived and is totally normal and totally fine, that's because of their diving reflex.
Unbelievable.
It slows the heart, it slows metabolism, it slows down everything. Now, on the TV show, yeah, he didn't leave his face in the bowl long enough to have a full-fledged
No,
diving
he didn't. But
reflex.
I did say to the audience that I think I said 30 seconds, if I
Yeah.
wasn't mistaken. Yeah, if I'm not
Yeah, I
mistaken.
mean, again, if your doctor says it's okay and you like self-experimentation, putting your face in a bowl of ice cold water, it doesn't even have to be ice cube cold, just cold
Just cold.
tap water.
Okay.
And check your pulse. If your pulse slows, then you've stimulated your vagus nerve.
Oh,
By
yay.
at least those fibers to the heart.
Oh, thank you. I'm so glad they brought this up, and now I
I
feel better about
I
having
have
said that
not
to many people.
I have not seen a good randomized controlled clinical trial of reducing inflammation by putting your face in cold water. And once again, it's a plea that everyone likes to talk about this. Let's set up the experiments and do them carefully with the right controls and the right. How do you randomize ice cold water? It's pretty hard to do that. You know when the water's cold and you put your face in it.
Exactly right. Exactly right. And also, your skin looks so nice afterwards. So that's like a little bonus. All right, let's get now to your book. I want to spend a little time talking about the book, The Great Nerve. Why did you feel now is the right time to bring out this book?
Because there are now new FDA-approved therapies targeting vagus nerve stimulation to treat conditions that for decades have been treated with powerful drugs. And and this is very new. The newness of the story required that combined with, as we keep talking about, the billions of web impressions on social media that are frankly overwhelming and confusing, even to someone who's studied the vagus nerve for 30 years. Those two things converged on what I thought was an important time to have a book that laid out the stories as scientists and doctors understand them today. This is
And
what
kind of
we
set the record straight too
set the
on
record
a
straight.
couple of things.
This
Absolutely.
this
And you
is
did.
this is what we know is true. This is what we know is false. This is what we don't know. This is what is probably misleading. This is what should be studied in a lot more detail.
Hmm.
And I don't. The book isn't selling anything. The book is. There's even a chapter in there as FAQs. Right. These are the questions that patients may want to ask their doctors,
Hmm.
particularly now, if the patient has rheumatoid arthritis. But the answers are for the patients too, and the answers are for the doctors too. It's written at a. I tried to write the book at a level that would not offend anyone's understanding, and that would inspire others to help try to answer the questions that we still don't have all the answers to, and mostly to be a resource for patients and their families. That's
Yeah.
why I thought the time should be now.
Yeah, no, it's a perfect timing, of course, as you just said, and it's a wonderful book. I think I've said several times how much I've enjoyed reading it, and you're a great storyteller. To also, on top of being an amazing researcher and medical expert and everything else that you do, you are a great storyteller. So you call your book, which The Great Nerve, you call the vagus nerve great. Why do you call it great?
The name wandering, which is what Vegas comes from, like vagabond, the name wandering didn't seem right to me, and it's a nerve it's not wandering. It knows exactly where it's going and exactly what it's doing, and its path to all your organs from your brain and back has been honed over hundreds of millions of years of evolution. So wandering didn't seem like the right word. I didn't set out to rename it. It turns out that Galen himself, one of the original 2,000 years ago, arguably one of the original modern physician scientists,
Mm-hmm.
he used to call it the great nerve.
Mm-hmm.
And the reason he called it the great nerve was because he understood that it was carrying information from the brain to the organs, the voice box, the lungs, the stomach, and that this information was really, really important because when he cut that nerve in the neck of animals on both sides, they all died. So, to my knowledge, and that's the only nerve, if you cut it on both sides in the neck, that's fatal. So I decided, well, Galen called it the great nerve. That's pretty good evidence that it is great. And I thought it'd be a good name for a book. So that's what I did.
Great. And it is great. And it's a great book. And in fact, it's so great. Everyone listening in, we are doing a giveaway. 10 copies of The Great Nerve will be given out. You're going to have to go to my Instagram account, Barbara Hannah Grufferman, and you will see all the details about that. But we are giving this wonderful, this great book away. So really do, join me over there at Instagram and you'll check it out. So, Dr. Tracey, this was incredible. I had many more questions. So I'm hoping that you come back at some point because I think we're going to have a lot of follow-up questions from the audience after this conversation. So I really want to thank you. Now, is there anything that I may have missed that in your mind is really important that you want to make sure the audience remembers from this conversation today?
I would, first of all, thank you and happy to return if there's questions that we didn't get to today. It's been a real pleasure talking to you as well, Barbara. I think the message to leave that can't be overstated, actually, for the patients out there that we didn't get to, and it's part of a much longer conversation, but don't let all the social media advice about just do this, that, and the other thing, and you'll be fine. Don't let that get you down because there is also a lot of evidence that damage can occur in the vagus nerve, and if that damage does occur, as we saw in long COVID patients, and we saw in the autopsies of some people that died from COVID, we saw that the virus had seriously damaged their vagus nerves. So it is possible that vagus nerve damage is actually contributing to conditions, and that if there was a simple fix for it, we said it before, then obviously people would do it. But now that there is a device available for rheumatoid arthritis, I'm hoping that it brings benefit to a lot of people. But don't we all have to be really, really careful when we say just do this, that, other thing, and you'll live to be 100 and never have any more aches and pains. If life was that simple, we'd all do it.
If only it was that simple. Again, everyone, the great nerve, Dr. Kevin Tracey, my guest. I am so grateful. I look forward to seeing you again, and thank you very, very much.